Let me start with a story. There was a girl by the name Chanda. She was 11 years old, very happy, had two chotis, would have ribbons at the end of choti, would have her bag and go to school every day with her younger brother. She loved studying. She loved school. Every day she would happily and merrily get up early, get the two chotis done and be ready for school, do her homework. Her teachers loved her as well. Well, just like every day, one day Chanda woke up. And when Chanda woke up, her mother called her and said, "Come here, dear Chanda." She's like, "Yes, mother. Tell me fast. What do you have to tell me? Because I'm getting late for my school." The mother breathes heavily and says, "Chanda, you are not going to go to school." She's like, "Why?" He says, "Yeah, from today onwards, you are not going to go to school." Well, of course, Chanda resisted that and argued and tried to reason, but the decision was irreversible. A life that could have a very different trajectory was put to an end that day. A potential that could have a flourishing trajectory was put to an end that day. Why? Chanda started menstruating. Menstruation is something that is as normal as breathing and digestion. There is no stigma about breathing, there is no stigma about digestion, but there is stigma about menstruation. Now, I have no problems against rules and regulations. Stigmas, taboos, certain practices, these are all basically rules of the do's and don'ts. But when the do's and don'ts put an unnecessary and an unexplained stop to the potential of a human being, I do have a problem. A girl who does not get education beyond her 7th or 8th grade has a very hard time because she will never get a proper job. Her position in her family will always be inferior. So in the front of education, on the front of family life, on the front of professional life, she's doomed. And menstruation is a stigma all across the world. I have now been doing systematic research in the area of menstruation for more than 15 years. I find stigma everywhere. I find lives becoming difficult because of menstruation everywhere. This stigma needs to be overcome. It needs to be normalized. There are certain changes that happen in a woman's body at that time. These changes are the very essence for the next generation to come in. Without menstruation, I don't even know what would the world look like if all women stopped menstruating for the next 20 years. So, menstruation is something normal. Women need to talk openly about it, and men need to listen with an open mind and a heart about it. The problem, the insensitivity is on both the sides. I have seen this. I have faced this as a researcher. Menstruation has also got a lot of implications on mental health. When there are so many changes going on in your body, all the different chemical changes, the physiological changes, mental health goes for a toss. And all this person needs is some understanding, some compassion, and some support. We've got to extend that. You've got to understand. You don't have to be a mental health expert, but you have to understand, realize, anticipate, and most importantly, forgive. Most people hold on to the different behavior or different reactions that they experience from their partners or from their mothers or from their sisters during that time. They take it personally and hold a grudge. No, you're making a mistake. Don't label a person based on that one particular thing. Nobody wants to experience pain every month, but still they go through it, they experience it, they live through it. Organizations need to understand. They just simply label women as less productive. Well, they are not less productive, they are actually more reproductive. Their ability, because of their ability, we are all alive. And we just designate that as less productive at workplace. No. I mean, how many more years and decades and millennia need to pass by until we have a healthy understanding and a provision for women in workplaces? Going back to Chanda, she was taken out of the school and education because she started menstruating. Schools in many parts of the world, they don't have proper hygiene and sanitary care. That means a woman or a girl who starts menstruating finds it very difficult to manage her menstruation when at school. So she does not go to school. This is, missing 3 or 4 days in a month. But in extreme cases like Chanda, where she's just taken out. Why? Because now she needs to focus on learning some other homely skills, and then she will be married off because now she can give birth to a child. This is a lifelong alteration and a change. So understand, there are different aspects. There are healthy ways of creating policies. There are more compassionate ways of developing policies and provisions for an inclusive workforce. You cannot build a healthy society by neglecting a regular and frequent need of 50% of the population. It is shameful that even in this age and day, there are people who don't understand what menstruation is. They look at it with a very castigating eye and they blame the person. Nobody asks for it. It happens. Just how you breathe and you digest food, menstruation also happens. So it is about time that we normalize it. We don't have to make a big deal out of it. It is something normal. We absorb it in our daily routine and move on. We don't deprive anyone of opportunities. Opportunities at life, opportunities at work, opportunities in education, opportunities in sport, opportunities in armed forces. We don't need to deprive them because of something normal and natural. The real problem starts when it does not happen. Ask a woman the trouble that she has to go through when she misses her periods. Not due to pregnancy, but otherwise. Or when she has an irregular cycle. It is so painful. It is also very personal. And it's just something that they have to live with. That's the cards that they were dealt with. So, better understanding, normalizing is required. One another thing that we all need to learn and understand is that advertisers, when they have to sell products, they will have to create villains, no? For someone to be hero and for someone to be liked, there has to be a villain. Imagine Sholay without Gabbar Singh. Sholay will lose all its effect and impact. So what advertisers do is that they problematize and they make menstruation a problem. And they bring in whatever pad, tampon as a solution, as a hero. But menstruation is not the villain. understand this, as you have to be a bit more media literate. You have to understand the tricks and techniques of media in how they represent things. And also, just because you use a certain brand of tampon or sanitary pad, you are not going to suddenly become all successful and everybody is going to like you and adore you. That is also not true. So understanding all these things, but most importantly that menstruation is not the villain. It is actually the real hero in the continuation of humankind. So focus more on the person, the needs of the person. The person also at the same time needs to be a bit more proactive and in advance help others around them as stakeholders to understand what they go through, so that the other people can also effectively manage and deal with them. So it's a two-way process, it's not one-sided. Both the parties, both the stakeholders that are involved have to have high empathy, high sympathy, greater compassion for one another to ensure that they go through this temporary phase in a as happy as possible manner. So with that, I am Dr. Arpan Yagnik and I sign off. And if there is someone around you who is menstruating, you have to take extra care of them. And if you are going to menstruate, you need to alert and advise and advocate to people around you that how they should be around you. Help them. So I wish you all that you educate yourselves and make aware about menstruation. And with that, I am signing off. Thank you so much.